Hello, my name is Justin, and I'm here with David and Shervin. Today we are very excited and delighted to tell you about Graves' disease.
But first, we're going to bore you with some amazingly fun facts about this disease. 1. Graves' disease causes your thyroid to become hyper and overproduce hormones that can send your body into a chaos. 2. It affects 1 in 1,000 people. And finally, did you know that George H.W. Bush also had this disease, and so did his wife?
Graves' disease is an autoimmune disease where the thyroid produces an excessive amount of thyroid hormones, T3 and T4. This is called hyperthyroidism.
Graves' disease happens when the body makes autoantibodies that bind to the TSH receptor, leading to hyperthyroidism or the release of T3 and T4 thyroid hormones. Normally, the release of thyroid hormones is mediated by thyroid-stimulating hormone, or TSH, a hormone secreted by the pituitary gland that binds to the TSH receptor to stimulate the release of thyroid hormones. This cycle is self-regulating. The hormones were secreted by the thyroid to keep more TSH from being produced. The autoantibodies produced in Graves' disease are not subject to negative feedback, so they continue to be produced and bind to the TSH receptor even when thyroid hormone levels are high. These antibodies act as stimulant, stimulating more hormones to be released and thus to hyperthyroidism. There are 3 types of autoantibodies that bind to the receptor. 1. TSI, thyroid-stimulating immunoglobulin. These antibodies act longer than the normal TSH. 2. Thyroid growth immunoglobulin. 3. Thyrotropin binding inhibiting immunoglobulins. These antibodies inhibit the normal union of TSH and its receptor.
The thyroid gland is an important organ of the endocrine system. It is located in the front of the neck, just below the voice box. This gland releases the hormone thyroxine, or T4, and triiodothyronine, or T3, which control body metabolism. Controlling body metabolism is critical for regulating mood, weight, and mental and physical energy levels. Graves' disease is the most common cause of hyperthyroidism. It is caused by an abnormal immune system response that causes the thyroid gland to produce too much thyroid hormones. Graves' disease is most common in women over age 20. However, the disorder may occur at any age and may affect men as well.
Signs and symptoms. Some general signs and symptoms of an overactive thyroid include a goiter, trouble sleeping, nervousness, heat sensitivity, hand tremors, tremendous weight loss, muscle weakness, heat intolerance, and brittle nails. Some symptoms that affect the eyesight are dry eyes, senses of irritation and pain, excessive tearing from cold air and bright lights, swelling, staring, and blurring of vision and the overall appearance of retracting eyelids. How to test for Graves' disease. There are 3 ways to test for Graves' disease. Thyroid function tests. A blood sample is sent to a lab to see if your body has the right amount of thyroid hormone T4 and TSH. A high level of thyroid hormone in the blood plus a low level of TSH is a sign of an overactive thyroid. Sometimes routine screening of the thyroid function reveals mild overactive thyroid in a person without symptoms. In such cases, doctors might suggest treatment or watchful waiting to see if levels return to normal. Number 2. Radioactive iodine uptake, RAIU. An RAIU tells you how much iodine the thyroid takes up. The thyroid takes up iodine and uses it to make thyroid hormone. A high uptake suggests Graves' disease. This test can be helpful in ruling out all other possible causes of an overactive thyroid. Number 3. Antibody tests. A blood sample was sent to a lab to look for antibodies that suggest Graves' disease.
Lifestyle implications. Graves' disease does not only impact your physical well-being. Mentally, it can also be very disturbing. Mood swings, thinking impairment, and other mental symptoms can be difficult to handle, making it appear that the patient is suffering from some mental disorder. There have been some cases where patients have been placed in mental institutions. Graves' disease affects your emotions, decrease your attention span, and cause memory problems.
Treatments for Graves' disease. Medications. Anti-thyroid medicines are used, in which two drugs are used in the United States. Mefimazole, or MMI, brand name Tapazole. Propylthiouracil, or PTU. These drugs keep the thyroid from making too much thyroid hormone. MMI is the preferred drug for most non-pregnant people. However, these drugs are generally not used for more than 1 or 2 years. For some people, thyroid function returns to normal when the drugs are stopped. However, for most people, the overactive thyroid comes back.
Graves' disease can also be treated using radioactive iodines or surgery. Radioactive iodine. The thyroid gland uses iodine to make thyroid hormone. With this treatment, you swallow a pill that contains RAI, which is a form of iodine that damages the thyroid by giving it radiation. The RAI destroys thyroid cells so that less thyroid hormone is made. This cures the overactive thyroid, but you will likely need to take thyroid hormone for the rest of your life to replace the needed thyroid hormone your body can no longer make. RAI has been used for a long time and does not harm other parts of the body or cause infertility or birth defects. Surgery. Most or all the thyroid is removed. As with RAI, surgery cures overactive thyroid, but you will need to take thyroid hormone to replace the needed thyroid hormone your body can no longer make. Medications that could treat neuropsychiatric symptoms include the usage of beta blockers, especially psychotropic drugs. The Graves' disease also affects the eye. Mild cases are treated with lubricant eye drops or non-steroid anti-inflammatory drops. Severe cases threatening vision are treated with steroids or orbital decompression.
Graves' disease often responds well to treatment. However, thyroid surgery or radioactive iodine will usually cause hypothyroidism or the lack of thyroid activity. Without getting the correct dose of thyroid hormone replacements, hypothyroidism can lead to depression, mental and physical sluggishness, and weight gain. Anti-thyroid medications can also have serious side effects.
Some of the key risk factors and triggers for Graves' disease and hyperthyroidism include being a female, personal and family history of thyroid problems, being at the age between 20 to 40, pregnancy, current or former smoker, excessive intake of thyroid hormone, and exposure to or excess of iodine drugs, and also trauma to the thyroid.
Due to the high frequency of patients with Graves' disease in a population of 1 to 1,000, there are many notable people who have also been affected with Graves' disease. One notable example is Marty Feldman, a British comedian who uses bulging eyes caused by TED, thyroid eye disease, to great effect in his career.
Prognosis. The disease typically begins gradually and is progressive unless treated. If left untreated, more serious complications could result, including bone loss and fractures, starvation, birth defects in pregnancy, and increased risk of a miscarriage. Graves' disease is often accompanied by an increase in heart rate, which may lead to cardiovascular damage and further heart complications, including loss of the normal heart rhythm, which may lead to a stroke. If the eyes are bulging severely enough that the lids do not close completely at night, severe dryness will occur with a very high risk of a secondary corneal infection, which could lead to blindness.
We hope we were successful in educating you about Graves' disease, which is one of the lesser-known diseases. It is useful to know about diseases with less publicity so that you can pass on this information to others and raise awareness about it. We hope you enjoyed this video.